CEN review video. Question 1. A 4-year-old presents with a 2-day history of a rash on the neck, chest, and back. The lesions on the neck are crusted, and the chest lesions are tiny vesicles on a pink base. The child has a temperature of 39.1 degrees Celsius. The father asks when the child can return to school. The nurse advises 24 hours after the last fever above 38.3 degrees Celsius. Tomorrow, once all the lesions are crusted. In 2 weeks when all the lesions are crusted. Question 2. After a fall, a patient on warfarin is found to have a subdural hematoma on CT. The nurse anticipates administering clopidogrel, vitamin K, fresh frozen plasma, both B and C. Question 3. A patient with pelvic inflammatory disease is being discharged. Which statement indicates the patient understands the discharge instructions? Getting pregnant shouldn't be a problem once the infection goes away. I'll take the medicine for nausea when I feel sick to my stomach. I will be at increased risk for ectopic pregnancy. I will follow up with my doctor tomorrow. Question 4. A patient presents with descending paralysis and areflexia following a recent viral illness. The nurse suspects Guillain-Barré syndrome, multiple sclerosis, myasthenia gravis, stroke. Question 5. A post-cardiac arrest patient remains comatose. The nurse prepares for emergent coronary angiography, therapeutic hypothermia, targeted temperature management, immediate extubation, administration of TPA. Question 6. A patient with a history of alcohol use disorder presents with confusion, ophthalmoplegia, and ataxia. The nurse suspects hepatic encephalopathy, Wernicke's encephalopathy, alcohol withdrawal, meningitis. Question 7. Which finding is most concerning in a patient with suspected right ventricular infarction? Hypotension, jugular venous distension, clear lung fields, ST elevation in lead 3 greater than lead 2. Question 8. A patient with a history of asthma presents with respiratory distress, minimal air movement, and an absent wheeze. This finding indicates the patient is improving. A silent chest, indicating severe bronchospasm. A pneumothorax. The patient needs a bronchodilator. Question 9. A patient taking sildenafil, Viagra, 2 hours ago now presents with chest pain. Which medication is contraindicated? Aspirin, nitroglycerin, morphine, atorvastatin. Question 10. A patient with a history of seizure disorder is actively seizing for 5 minutes. The nurse's priority is to place a tongue blade in the mouth, restrain the patient, administer 4-lorazepam, start in 4. Question 11. A 2-year-old child presents with a barking cough, stridor, and respiratory distress. The nurse suspects epiglottitis, croup, foreign body aspiration, asthma. Question 12. A patient with chest pain has a 12-lead ECG showing a new onset left bundle branch block. The emergency nurse should prepare the patient for a stress test, immediate transfer to a medical surgical floor, coronary angiography, observation for 6 hours. Question 13. A patient with 3rd degree complete heart block is bradycardic and hypotensive. The nurse should anticipate atropine 0.5 milligrams for push, transcutaneous pacing, adenosine 6 milligrams rapid for push, amiodarone 150 milligrams for. Question 14. A patient presents with chest pain, fever, and a friction rub on auscultation. The nurse suspects myocardial infarction, pericarditis, unstable angina, aortic stenosis. Question 15. The nurse is performing a secondary assessment on a trauma patient and notes a GCS of 12, a respiratory rate of 30, and an SpO2 of 89% on room air. The nurse should apply oxygen and prepare for intubation. Complete this secondary survey before intervening. Place the patient in a high Fowler's position. Administer naloxone. Question 16. A patient presents with a swollen, bruised leg after a blunt injury. The nurse notes tense compartments, severe pain on passive stretch, and paresthesia. The nurse suspects deep vein thrombosis, compartment syndrome, cellulitis, rhabdomyolysis. Question 17. A patient presents with altered mental status, fever, and a petechial rash. The nurse suspects viral meningitis, bacterial meningitis, encephalitis, anaphylaxis. Question 18. A patient presents with an opioid overdose with respiratory depression. The nurse should administer flumazenol, naloxone, activated charcoal, atropine. Question 19. A newborn with meconium-stained amniotic fluid is delivered. The nurse should suction the mouth and nose immediately, dry and stimulate the infant, perform a brief assessment and begin ventilation if needed, intubate and suction the trachea. Question 20. A 64-year-old male presents with crushing substernal chest pain radiating to his jaw and left arm. He is diaphoretic and nauseated. His ECG shows ST segment elevation in leads V1, V4. The nurse anticipates an order for aspirin 324 mg chewable, morphine sulfate 4 mg for push, nitroglycerin 0.4 mg sublingual. All of the above.